Hello people, in this video we want to look at neovascular glaucoma. So what is neo? Neo means new vessel, so new blood vessels causing glaucoma, right? This is what is neovascular glaucoma, right? So where exactly are we? We are looking at secondary glaucomas. In secondary glaucomas, guys, here you can see you have neovascular glaucoma, right? So what happens whenever there is ischemia, right? The blood flow is reduced. That time there is less oxygen, right? There is less oxygen, right? So what happens when the oxygen is less? There are new blood vessels. So this new blood vessels, what will happen? They will cause closure of this angle, leading to raised intraocular pressure, further leading to optic disc damage, visual field defects, that is glaucoma, right? So now what are we talking about? Neovascular glaucoma. So this is an angle closure glaucoma. Why is this happening? Because of ischemia. So where and all have you so far seen ischemia and neovascularization? Neovascularization you have seen in diabetic retinopathy, right? So you have non-proliferative diabetic retinopathy and then proliferative. Proliferative will have neovascularization, right? So in then you have CRVO. CRVO, that is the ischemic kind. So the name itself is a giveaway, ischemic. So ischemic only will lead to neovascularization, right? So that will lead to this neovascularization and that will lead to glaucoma. Sickle cell retinopathy, Eales disease, retinal vasculitis, right? This is also having neovascularization. Even in retinoblastoma in grade E, that is very high risk, right? In that one also you will have neovascularization. Okay, so what are we looking at? We are looking at neovascular glaucoma. So many other reasons are there. Okay, so basically what did you learn so far in this? There is neovascularization. See here you can see rubeosus iridis. So that is neovascularization of iris. So this leads to angle closure, right? So which part is actually getting neovascularization, which is causing the glaucoma? This iris itself is becoming neovascular. That time what will happen? This angle will get closed and there will be glaucoma. Okay. So what are we looking at? Neovascular glaucoma. Now let us look at what will happen to these people. These people will have some stages of neovascular glaucoma is there. Pre-glaucomatous stage, that is the rubeosus iridis. The iris has new blood vessels, rubeosus iridis, neovascularization of iris. Then you have open angle glaucoma stage. At this point, the angle is still open, right? Due to formation of pretrabecular neovascular membrane. Then they'll go into angle closure. This is so strange, right? First angle is open, then they are going into angle closure. Yeah, before angle closure, it has to be open. Yeah. Due to goniosynechiae, goniosynechiae resulting from contracture of the neovascular membrane. See, first of all, there is some neovascular membrane. Till then, it was fine. Then what happened? There is contracture of this membrane leading to goniosynechiae, that is the angle, right, sticking. So that is what is zipper angle closure. So they're using some terminology here, zipper angle closure. Then that will go into glaucoma, right? Did you understand, guys? So there is neovascularization of iris, that is pre-glaucomatous. Then what happens? Some membrane is there, neovascular membrane. This membrane contracts and it goes into angle closure. That time what will happen? These people will go into glaucoma because of contracture of this neovascular membrane, zipper angle closure. Remember, goniosynechiae, okay? And then they're going to absolute glaucoma. So basically, what are the stages? If somebody asks you the stages, say stages pre-glaucomatous, rubeosus iridis, then open angle, then angle closure, okay? So absolute glaucoma will be there, severe pain, stony hard eye, etc. They will have optic nerve damage and visual field defects. How will you treat this? Because this is caused by ischemia leading to VEGF, right? So what will happen when there is ischemia? There is low blood supply, so oxygen is low. So the retina releases VEGF, that is vascular endothelial growth factor, right? And this will lead to new blood vessels, and new blood vessels are the problem here. So what they will give? They'll give anti-VEGF drugs like bevacizumab, ranibizumab, alfibercept. Okay, alfibercept. So these drugs you have to mention. And then they will do pan-retinal coagulation, photocoagulation. What did I say, guys? Pan-retinal photocoagulation, PRP they will do. Except this macular area and around it, they're photocoagulating the retina, right? So that new blood vessels will not form. Okay. So then what else they are giving here? Anti-glaucoma drugs. And then they are doing glaucoma drainage devices they are giving. Look at this. This is the glaucoma drainage device, that is Ceton, that also can be given. Because these people have neovascularization that they are not able to stop, right? New blood vessels have already come. Further neovascularization only they are stopping. So then they are giving cyclocryopexy. They are destroying the ciliary body, right? Ciliary body destruction with cyclocryopexy. So a lot of things they have mentioned here. So what are the treatments? Anti-VEGF drugs, anti-glaucoma drugs, pan-retinal photocoagulation, very similar to your diabetic retinopathy, pan-retinal photocoagulation, and then cryopexy, cyclocryopexy, where you are destroying the ciliary body. Then glaucoma drainage devices, Ceton. Okay. So this is all about neovascular glaucoma. Guys, this happens where and all? In diabetic retinopathy, then CRVO, ischemic CRVO, Eales disease, right, etc. Retinoblastoma also it can happen. Here there are new blood vessels because of ischemia, and there is rubeosus iridis, because of which there will be angle closure, right? So what are the three stages? You have the pre-glaucomatous stage of rubeosus iridis, then you have the open angle glaucoma stage where there is a neovascular membrane, pre-trabecular, and then this contraction of this neovascular membrane happens. Zipper angle closure, remember, zipper angle closure. So this is more like a zip. Goniosynechiae, right? And then you have the treatment mentioned here. Pan-retinal photocoagulation, anti-VEGF drugs like bevacizumab, ranibizumab, aflibercept. Then they are giving conventional filtration surgery, etc., medical therapy, anti-glaucoma drugs. Then they are giving glaucoma drainage devices, Ceton, right? What is the name for that? There is some name, right? This is Molteno implant, right? Molteno. Then you have this cyclocryopexy. Okay. That's it, guys. We are done with neovascular glaucoma. Bye-bye.